over now to The Australian with another story making news tomorrow. Lift wages of low paid by inflation. Hundreds of thousands of low paid workers should receive inflation-linked pay rises, the Albanese government has urged. As business warns the economy risks being plunged into recession if unions succeed in their push for a 7% increase for 2.6 million workers. Erin, how do you think that this will play out, not only for the government, but for big corporations tomorrow?
Well, forget the big corporations. Let's look at small business and how they're going to cope with it. I mean, I look at this as a small business owner and wonder how I could put up wages of employees that's along the rates of inflation. I mean, I don't disagree from an ideological standpoint about low-income workers, but I think that this is more of a structural problem. So I think about nurses, I think about teachers and the undervaluing of their work, aged care workers, childcare workers, over-representation of women in these particular sectors as well. But saying inflation is the reason to do that when we are using other measures such as interest rate rises to try and, try and slow inflation down a little bit, I think we need to be having those other conversations. It sounds like we only want to deal with women's work when it's, look at inflation, but actually let's look at valuing those sectors and what they contribute to the economy, regardless of this broader macroeconomic environment we're seeing around the world right now.
Yeah, speaking of around the world, all eyes were on Japan today because Japan's energy warning for the PM was issued. Takayuki Ueda, chief executive of Japanese gas giant INPEX, has warned that Anthony Albanese's sweeping energy market interventions will choke investment, strangle expansion of LNG projects and allow Russia, China and Iran to fill the void. Michelle, we spoke about this earlier and Sharri Markson opined on this on her show earlier this evening. It is very concerning that now international voices are being so stern in their condemnation of the Safeguard Mechanism Bill which passed today.
Yeah, look, it is kind of a warning, but it's interesting to me that a lot of these warnings are coming from the heads of gas companies themselves, who have themselves, they've got their own self-interest when we think about it. But at the end of the day, what we need to look at is what we have done and what successive governments have done with our gas production. We have sold it off to the highest bidder and forgotten that, us will need, like Australians, will need it ourselves. We've sold it off and then it gets cleaned up and then it gets sold back to us for twice the rate. I think the problem is that we have not protected our own resources. We've just sold them to the highest bidder, and I think we need to have long, hard conversations about what we're doing to those resources and how we're going to keep them in-house and how we're going to benefit from them in the future.
Yeah, and a good evening to former West Australian Premier Alan Carpenter for his genius, even though that was quite painful a few years ago, but that was a pretty good gas policy, looking back on things now. Look, let's go from LNG over to Medicare, because it is one issue that is going to impact a lot of Australians moving forward. $4 billion ripped out of healthcare is the headline on The Australian tomorrow. The erosion of the Medicare rebate is hitting the most vulnerable Australians hardest, with new analysis revealing almost $4 billion was denied to patients in rebates under years of freezes. Erin, health, you and I have been on this show for, it seems like every week that we speak, we are talking about issues with the health system. Now it is Medicare under a microscope.
Well, I think that Medicare has been under a bit of a microscope for a while and in the headlines, and we hear general practitioners all the time talking about how Medicare is broken, and it's not unsurprising that of course it hits the most vulnerable. And in Australia, where we look at this from sort of talking about ideology tonight, ideological perspective, an existential perspective, whatever you want to call it, healthcare, education, social protections are really key fundamental parts of this country that make us, really stand out amongst the liberal democracies and should be protected under all costs. So I think that, making sure that we get whatever the Medicare reform needs to be, we need to get it right. We need to make sure that the most vulnerable people can go to the doctor, don't have to make those choices. Because I tell you what, if I had to be paying $40, well, I do have to pay $40 when I go see my GP, but it doesn't bother me if I have to pay $40. But if I had to make that choice, like I did when I was a student, I wouldn't be going to see a GP. And back in those days, we had these little things called bulk billing doctors. And, you know, we went into the emergency only recently, right? And my daughter, could go straight through. She was really sick. But the amount of people in the waiting room at 3 o'clock in the morning at the Children's Hospital, because the only option is that rather than going to see a GP, you know, things are pretty abysmal out there.